control or the thyroid gland is under the control of thyroid releasing hormone, and that is the hypothalamic pituitary axis to secrete the thyrotrophic hormones to stimulate that is the TSH, to stimulate the thyroid follicular cells. There are certain TSH receptors on the surface of thyrotrophs, on the surface of the thyroid follicular epithelial cells to stimulate them to secrete and produce the thyroid hormone T3, T4. So negative feedback mechanism will be initiated after elevation or increase the level of thyroid hormone within the blood to suppress the thyroid releasing hormone and TSH from the hypothalamic pituitary axis, whereas positive feedback mechanism will be induced by lowering the thyroid hormone within the blood to stimulate the releasing hormone from the hypothalamic, centrally from the hypothalamus and pituitary. Thyroid is under the positive and negative feedback inhibition. So that is the concept of hyper and hypothyroidism, whether primary or secondary. To study the disorders or thyroid pathology, we will talk about main topics: hyperthyroidism, hypothyroidism, thyroiditis, that is mainly autoimmune, and multinodular goiter, or called diffuse-multinodular goiter, or colloid goiter, or endemic goiter, many terms, and neoplasms, including adenoma and carcinoma, and congenital malformations, including thyroglossal duct cyst, and so on. Goiter, when we say goiter, means enlargement of the thyroid gland, whether it is diffused enlargement or nodular enlargement, forming nodularity, or diffused homogeneous enlargement of the thyroid gland. It can be caused most commonly by colloid goiter, هذا اللي نسميه endemic goiter, or multinodular goiter, or colloid non-toxic goiter, and so on. Graves' disease, or that is autoimmune hyperthyroidism, and commonly seen, just also seen in our country and locality, and most common in the Western countries. Thyroiditis, whether that is most commonly autoimmune, Hashimoto thyroiditis, lymphocytic thyroiditis, subacute, and Decarbian thyroiditis, all types, and tumors. So goiter means not only colloid goiter, mean enlargement of the thyroid gland. Thyroid enlargement, whatever the cause: cyst, thyrotoxicosis, Hashimoto, Graves' disease, tumor, nodule. Goiter is enlargement. So goiter is enlargement of the thyroid gland. Here is mainly in the right lobe. Goiter, here the enlargement is هنسميها multinodular, or enlargement is mainly in the right lobe, whereas the normal homogeneous location on anterior to the trachea. Colloid goiter, or called colloid multinodular goiter, it is very common, especially in iodine deficiency, areas endemic with iodine deficiency. It is more common in female, very common in our locality, especially in the middle and north of Iraq. Most of the cases started as diffused enlargement. First started as diffused enlargement to compensate the deficiency in thyroid hormone in the blood as a result of iodine deficiency. Nodularity will be started with in advancing stages after many years, to become nodular and non-homogeneous goiter. It represent the compensatory hyperplasia of follicular epithelium to secrete thyroid hormone, secondary to decrease thyroid hormone production. Most common, very common, most of the thyroid disorders are more common in female, especially colloid goiter, and it is most commonly seen in female, especially in adolescence, when there is increase the demand for thyroid hormone, which is an anabolic hormone, maintain cell metabolism or enhance cell metabolism, and it is aggravated or accentuated the thyroid requirement after puberty, after lactation, after pregnancy, and the thyroid gland started to enlarge, to compensate, to become hyperplastic, to compensate the deficiency. The deficiency is mainly familial. There are certain families have certain deficiencies in enzymes important for thyroid hormone production and synthesis, and in addition or in conjunction with endemic iodine deficiency with the associated familial enzyme deficiency important for thyroid hormone synthesis. It is called diffuse-multinodular or endemic goiter or colloid non-toxic goiter. هذه كلها يعني common كلها names يعني موجودة. Endemic goiter means they are in endemic areas endemic with iodine deficiency. That is in which the water, soil are deficient in iodine. That are the areas far from the sea or beaches or يعني الareas البعيدة عن البحار أو اللي ما بيها ملح بحري أو كذا. The soil, even the plants and the fish are deficient in iodine because they are grow in areas endemic with iodine deficiency. The sporadic هذه معناها in areas without endemic present in areas without يعني مثلا احنا بالعراق in the south of Iraq it is called sporadic because in the south of Iraq the area is not endemic there with iodine deficiency whereas the middle and north of Iraq is endemic with iodine deficiency. It is maybe associated with mild defects, iodine deficiency, and physiological needs. So both of the mild defects, as I say, mild defect, familial deficiency for enzyme important for thyroid T4 synthesis, and an association and becomes more apparent with increased physiological needs in puberty, pregnancy, and lactation. When there is lowering of low T3, T4, there will be increase in the thyroid releasing hormone and TSH from the hypothalamus and from the pituitary that are induce the secretion and stimulate the secretion of thyroid hormone and the target follicular epithelial cells. This will be associated, this continuous stimulation, this continuous TSH stimulation will be associated with hyperplasia, enlargement of the thyroid gland, hypertrophy, and hyperplasia of the follicular epithelium at the earlier stages. So at the start, the enlargement is diffused and homogeneous, and by time becomes nodular. After many years, say 15 years, 10 years, becomes nodular. This nodularity is related to uneven hyperplasia of the follicular epithelial cells to TSH stimulation. So, hyperplastic stage, that is the homogeneous diffuse enlargement, and the colloid goiter or nodular stage. So, repeated attacks for many years result in multinodularity. This multinodularity again is due to uneven hyperplasia of the follicular epithelial cells to the stimulatory effect of TSH. يعني قسم من الfollicles respond more than others. So hyperplasia becomes uneven. This will result in nodularity, enlarging nodule, hyperplastic nodule, cystic change. So accumulation of colloid as a result, colloid will be accumulated as a result of tension and stress that result from rupture, lead to rupture of the follicle. Huge size can be result with compression symptoms on the trachea, on the esophagus, so result in dysphagia and result in airway obstruction, choking sensation, stridor, and retrosternal extension in advancing stage, and also result in superior vena cava syndrome. Superior vena cava syndrome شباب معناها compression or pressure of the enlarging thyroid gland on the superior vena cava, resulting in dusky face and engorgement of the neck veins and vein enlargement, tachycardia, and heart failure. Toxic hyperthyroidism, or called plumber disease, this is a result from evolution or presence of emergence of hyperplastic nodule within the enlarging thyroid gland. Again, mass effects can be misdiagnosed as tumor, so ultrasound and other investigations are needed to exclude neoplasm or another condition by the fine needle aspiration cytology, ultrasound, isotope scanning, and CT scan MRI. شباب الصوت واضح؟ أكو سؤال لحد الآن؟ أكو سؤال؟ شباب compare واضح الصوت لجروبين، جروب 1 and 2 شباب؟
واضح دكتور.
So compare this normal, fleshy, homogeneous, pink-colored thyroid parenchyma with this one in which there is no start of nodularity and fibrosis is seen here. This is a nodule again, nodular goiter. That is what I mean by nodular formation as a result of uneven response and hyperplasia and uneven response to TSH stimulation by the thyroid follicles. This is what I mean by advanced stage with associated compression syndrome, compression symptoms, including dysphagia and dyspnea and stridor and pressure symptom on the trachea and even inferior vena cava syndrome. This is seen in advancing stage. Say that is the enlargement started since adolescence and since teen age or by the age of 80 and more, and in the age of 40s and 50s after many years, becomes nodular with huge enlargement, can reach up to 2 kilograms enlargement with compression symptoms. These are goiterogenic vegetables, mainly, and they are called goiterogenic vegetables because they are interfere with iodine absorption and iodine uptake by the thyroid follicular epithelium, whereas fruits are not. This is a cut section, showed you the nodularity, fibrosis, and multinodular cut section on the surface with cystic degeneration, thick colloid collection within the thyroid gland, and fibrosis and calcification. So at the earlier stages, there is symmetrical enlargement, diffuse enlargement of the thyroid gland, and at late stages, nodularity, as you see, becomes more apparent, and cystic degeneration, hemorrhage, fibrosis. Microscopically, there is a randomly sized colloid nodule, and the pressure on the follicular epithelial cells to become flattened with thick colloid collection with alternating areas of hyperplasia, fibrosis, cystic changes, and hemorrhage with hemosidine-laden macrophages as a result of rupture of the follicle and a passage of colloid into the interstitium to induce this inflammatory reaction and hemosidine-laden macrophages as to engulf bleeding or colloid in the interstitium. Sometimes within multinodular goiter, there is incidental finding of papillary carcinoma within nodular. This is a cyst, and this is nodularity in multinodular colloid goiter, and papillary carcinoma can be seen as an incidental, can be discovered as incidental finding. This is the multiple nodule or nodularity or enlargement, diffused enlargement and nodularity, and here there is a solitary nodule at the start. هذه نسميها solitary thyroid nodule, which is important, differentiated from tumor, because whereas multinodular goiter, it is a common feature of colloid non-toxic goiter, whereas a nodule, solitary nodule, should be differentiated from or should be diagnosed or should be aspirated by fine needle aspiration to pick up neoplastic process, because it is a risk. There is an increased risk of neoplasm for solitary. Solitary, I mean single thyroid nodule in one lobe. Again, nodularity, cystic chain. This is a cyst. This is a non-homogeneous enlargement of the thyroid gland, cystic chain, bleeding, and so on. This is a cyst, and this is another cyst, colloid cyst in multinodular goiter, cyst containing thick colloid. So enlargement of the thyroid gland and flattening of the pressure by flattening of the follicular epithelium with dense colloid in the center. Colloid multinodular goiter or non-toxic goiter. Okay. Shabab, any question regarding multinodular goiter or endemic goiter؟ قبل لا أي سؤال لحد الآن؟ Okay. The state of another part or compartment of thyroid pathology is hyperthyroidism. It is in which the thyroid gland, it is a thyroid gland hyperfunction, result in overproduction of thyroid hormone. It can be primary related to abnormality or dysfunction of thyroid gland, internal. So primary hyperthyroidism, the process is internal to or endogenous to thyroid gland, whereas secondary hyperthyroidism means there is increase in TSH stimulation, increase in thyrotropic hormone secretion, TSH, from the pituitary gland, primary and secondary. Hyperthyroidism is caused by excessive amount of thyroid hormone production by overactive thyroid gland, whether primary, related to endogenous thyroid gland pathology or dysfunction, or secondary, related to increased TSH secretion by the pituitary, increased TSH secretion. Again, hyperthyroidism is a hypermetabolic state. As you know, T3, T4 are hormones increase or cell metabolism. They are so hyperthyroidism is a hypermetabolic state related to a sympathetic nervous system stimulation, palpitation, lowering of body weight in spite of increased appetite, and hyperkinetic or twitches, sometimes tremor, so it is related to sympathetic nervous system stimulation. Increase in thyroid hormone synthesis, whether it is primary or secondary, result in thyrotoxicosis. So the state of thyrotoxicosis is related to increased circulating thyroid hormone, increased T3, free T3 and T4 within the blood, whether related to, so the difference between hyperthyroidism and thyrotoxicosis. Hyperthyroidism means the hypermetabolic state is related to the thyroid gland, whereas thyrotoxicosis, it is related to increased circulating thyroid hormone, whether it is related to the thyroid or not to the thyroid. So let us say, for example, excess administration of thyroxine, for example, excess administration of thyroxine, for example, or tumor secreting thyroid hormone like stroma ovary and the ovarian mature cystic teratoma. So there is exogenous source for thyroid hormone that is result in increasing the level of thyroid hormone in the blood. Both of them are hypermetabolic state, whereas hyperthyroidism means the hypermetabolic state is related to the thyroid gland itself, whether primary or secondary. The causes of hyperthyroidism, the most related either the common or uncommon causes. The common causes include diffused toxic follicular hyperplasia, follicular hyperplasia, that is Graves' disease, semi-diffuse toxic follicular hyperplasia or toxic hyperplasia, in which the enlargement, in which the goiter is homogeneous and diffused, involving all the thyroid parenchyma evenly. The other cause, that is the toxic multinodular goiter. This is an advanced stage of colloid non-toxic goiter or endemic goiter, in which after many years of colloid goiter, there is emergence of hyperplastic nodule, semi-dominant hyperplastic nodule in patient with endemic goiter, in patient with multinodular goiter. This type, number 2, this is the most common type in Iraq. In our country, this is the most common cause of thyrotoxicosis in Iraq, toxic multinodular goiter, emergence or presence of hyperplastic nodule within multinodular goiter. And the third cause is toxic adenoma. This is a neoplasm. Follicular adenoma can be toxic. Can be بنقول toxic معناها شنو شباب؟ What is toxic? What is toxic?
دكتور يعني high secretion of T3 T4.
Yes, there is when we do a laboratory test, there is an increase in T3 T4 and decreased TSH. What about TSH in toxic adenoma? Yes, exactly. In toxic adenoma لأن هي تطلع T3 T4 فأكو شنو نسميه هذا negative feedback mechanism. صحيح؟ Negative feedback mechanism. Okay. So okay. So in our country, what is the most common cause of hyperthyroidism in Iraq? What is the most common cause of hyperthyroidism in Iraq?
Toxic multinodular goiter.
Toxic. Yes, exactly. أو نسميها nodular hyperplasia اللي هي مرات نقول بين قوسين advanced stage of multinodular goiter. Nodular hyperplasia or advanced stage of multinodular goiter. ماشي؟ Okay. هذا التايب this type اللي هو الجريفز this is more common in Western countries. Okay, this is most common cause of hyperthyroidism when in areas or in Western countries when there is no iodine deficiency, not endemic. Toxic adenoma, neoplasm or follicular adenoma that can be associated with toxicity features of hyperthyroidism as a result of increased T3, T4 or thyroid hormone production. Sometimes adenoma is euthyroid أو نسميها not associated with toxicity. Whereas uncommon causes thyroiditis at the start بالبداية thyroiditis because of destruction of the follicles that will be associated with the release of thyroid hormone into the circulation. So at the start it is associated with thyrotoxicosis. Hashimoto thyroiditis نسميها hashitoxicosis بالبداية at the start. In advancing stage, this will, after follicular destruction and fibrosis, parenchymal fibrosis, it will be associated with بالعكس تصير hypothyroidism. Functioning thyroid carcinoma هذه rare functioning thyroid carcinoma يعني اللي هي uncommon TSH secreting pituitary adenoma. شباب هذا شو نسميه هنا thyrotoxicosis in such a state. TSH secreting in the setting thyrotoxicosis, hyperthyroidism in the exactly thyrotoxicosis in the setting of TSH secreting pituitary adenoma. ايش سميناها البارحة this type of adenoma؟ سميناها شنو اسمها الآخر؟ Thyrotroph adenoma, yes. Basophil or acidophil. Basophil or acidophil are neoplastic. Basophil, yes. ممتاز. Whereas iatrogenic, هذا الإياتروجينيك شنو شباب؟ هسه أنا قلته iatrogenic. What is iatrogenic thyrotoxicosis? واحد ينطوا high dose of thyroxine hormone. This will induce a hypermetabolic state or thyrotoxicosis. Excess dose or ياخذ جرعة أكثر من اللازم من الثايروكسين. This is iatrogenic induced. And stroma ovary. What is stroma ovary شباب؟ هسه أيضا قلته تذكروا.
Ovarian tumor دكتور.
Ovarian tumor, mature cystic teratoma. اللي هاي التيراتوما بها كان مثلا multiple يعني هي teratoma, so germ cells can contain any type of tissue, epithelial, nervous, respiratory epithelium, skin adnexia, and even thyroid tissue can be seen within this ovarian cyst or ovarian teratoma. So this is an ectopic secretion. هذا شو نسميه هنا؟ نسميه hyperthyroidism. شو نسميه؟ نسميه hyperthyroidism ولا نسميه thyrotoxicosis? Yes, it is okay. It is thyrotoxicosis in hypermetabolic state related to increase in thyroid hormone within the circulation. Here, the thyroid gland is not affected, or the cause of thyrotoxicosis is not related to the thyroid gland. It is related to ectopic thyroid hormone increase in the blood. Choriocarcinoma and HMOL هذولا ممكن أيضا can secrete ectopic thyroid hormone or TSH. Clinical features for hyperthyroidism, whether primary or secondary, primary related to thyroid hormone or secondary to pituitary TSH secreting adenoma. Nervousness features, so شباب, features of sympathetic nervous system stimulation. Nervousness, palpitation, muscular weakness, weight loss with good appetite, diarrhea. All of these are hypermetabolic. Heat intolerance, warm skin, excessive sweating, emotional instability, menorrhagia بالعكس بالhypothyroidism يصير menorrhagia and menstrual irregularities, fine tremor of the hand, fine tremor or shaking of the hand, eye changes and enlargement of the thyroid gland. شو نسميه enlargement of thyroid gland? goiter, exactly. Eye changes هسه اللي نشوفها اللي هي including exophthalmos and another changes. Cardiac manifestation. هذه الcardiac manifestation شباب are more evident, more common in elderly people, including tachycardia, arrhythmias, palpitation, or fibrillation of يعني هذه SVT caused. This is more common in يعني cardiac manifestation والcardiac abnormalities والECG abnormality is more common in elderly population. Graves' disease, هذا اللي قلنا عليه Graves' disease. This is a common cause of hyperthyroidism in Western countries. It is an autoimmune disease and associated with other autoimmune processes. Female are more affected. All the thyroid pathology, most of them are more common in female than male. It is associated with HLA-B8 and DR3 and Graves' disease. It is a clinical diagnosis. Graves' disease مو فقط نقول Graves' disease بالبايوبسي فقط, لا. It is a trait of clinical diagnosis. There should be hyperthyroidism. That is the excessive hypermetabolic state endogenous to the thyroid gland. Exophthalmos and retraction of the upper eyelid and pretibial myxedema. There are antibodies, so it is autoimmune process. There is antibodies to TSH receptors, thyroid stimulating antibodies. Thyrotropin binding inhibitors or immunoglobulin are responsible for hyperfunction. Thyroid stimulating immunoglobulin, these are antibodies bound to TSH receptors. They act as an analog similar to TSH and are responsible for hyperplasia. So there is antibodies to TSH receptor. Thyroid stimulating immunoglobulin antibodies that is bound to TSH receptors and responsible causing stimulation and increase the thyroid hormone synthesis and release. The follicles are diffusely hyperplastic. The cuboidal cell becomes tall, active, columnar with papillary unfolding, and scalloping of colloid, which becomes pale and few or scant in amount. The laboratory test, including decreased TSH because there is excessive endogenous thyroid hormone levels produced or synthesized, and also increase in thyroid stimulating immunoglobulin, that is antibodies to thyroid hormone receptor on follicular epithelial cells. A very serious complication is thyroid storm that is associated with rash or severe elevation or excessive increase in the level of T3, T4 thyroid hormone within the blood, and associated with tachycardia, palpitation, and even heart failure. Thyroid storms should be treated by antithyroid medication. This is a diagram to show the symptoms of hyperthyroidism, including hair loss, lid retraction, lid lag, goiter, heart manifestation that are more common in elderly people, including tachycardia, palpitation, and atrial fibrillation, increased bowel movement with diarrhea, warm and moist skin, tremor, onycholysis, and acropathy, that is thin skin and warm skin, pretibial myxedema, menorrhagia, weight loss despite good appetite, exophthalmos, anxiety, osteoporosis, and proximal myopathy. exophthalmos which is so شنو قلنا شباب هسه احنا الجريفز is a clinical diagnosis. Number 1, hyperthyroidism or primary hyperthyroidism. Number 2, exophthalmos. Number 3, pretibial myxedema. هذين اللي ثلاثة لازم موجودات ثلاثتهم to diagnose Graves' disease. The eye protruded from the orbit due to increased glycosaminoglycan deposition in retrobulbar or retroorbital tissue, retroorbital fibrofatty tissue, and in addition to excessive lymphocytic infiltration. Thyroid stimulating immunoglobulin stimulate the fibroblast in the eye orbit to increase the production of this glycosaminoglycan within the soft tissue in the retroorbital area, result in protrusion of the eyeball and exophthalmos and lid retraction. يعني lid retraction يعني lid is retracted or ينسحب. It is associated with difficulty in closing the eye and even corneal ulceration and dryness of the eye. This is the collection of glycosaminoglycan within the retroorbital soft fibrofatty tissue and bulging of the eye and lid retraction. This is the infiltrative myopathy. Glycosaminoglycan will build up in the hand and in the feet, result in what we call it pretibial myxedema and pitting edema. This is the homogeneous. هذا شنو شباب شو نسميه homogeneous enlargement. شوفوا الcut section شلون flashy, richly vascular because of excessive hyperplasia. The hyperplasia here is diffused and non-nodularity, and homogeneousness is present and evident, rich vascularity and fleshy cut section. Homogeneous enlargement. So the goiter here is symmetrical مو مثل النودولار goiter اللي هو asymmetrical, beefy or fleshy cut section. هذا الدقيقة. This is the sorry. Graves' disease. This is what we call it. Follicular hyperplasia. Follicular hyperplasia. Compare this thyroid cut section with the follicles of normal resting thyroid gland, and you identify the papillary enfolding, pseudopapillary formation due to follicular hyperplasia. يعني هسه هذه كلها follicle with formation of pseudopapillae due to papillary folding and enlargement and hyperplasia and columnar shape of the follicular epithelial cells. The colloid is few in amount, scanty and faint, with scalloping of the border due to activity, due to active synthesis and active pinocytosis of by the adjacent follicular cells. These are the papillary enfolding. Papillary enfolding أو نسميها papillary tufting or papillary pseudo-papillary formation. They are pseudo-papillae, not true papillae, not to mess with the papillary carcinoma of thyroid. Again, here papillary enfolding is prominent with scalloping of the borders of the colloid. This is the scalloped or vacuolated colloid, and identify the columnar shape of the follicular cells because they are hyperplastic, active, and in uptake, and in which there is an active pinocytosis in hyperthyroidism. The opposite. شباب لحد الآن أكو سؤال على hyperthyroidism, Graves' disease. Causes, the most common cause in Iraq is nodular hyperplasia or multinodular hyperplasia, that is nodular toxic hyperplasia, that is advanced, whereas in Western countries, Graves' disease is most common. Hypothyroidism, the opposite, it is a hypometabolic state caused by underproduction of thyroid hormone. Hypometabolic state caused by underproduction of thyroid hormone T3, T4. There is decreased availability or decrease in the level of thyroid hormone within the blood that lead to generalized slowing of the thyroid hormone-induced cell metabolism. Generalized slowness of the cell metabolism and cell activities. Accumulation and also accumulation of matrix glycosaminoglycan within the interstitial space, resulting in myxedema. Again, thyroid hormone deficiency can be primary related to dysfunction of the thyroid gland itself, endogenous dysfunction of thyroid gland, or can be secondary or central hypothyroidism related to diminished TSH releasing hormone or TSH stimulating hormone from the pituitary hypothalamic axis. So primary and secondary hypothyroidism. This is the complication, cretinism and myxedema, cretinism in childhood and myxedema in adult, due to lowering T3, T4 and high TSH without response or without increase in the level due to abnormality in thyroid gland. The causes of hypothyroidism, either autoimmune thyroiditis, most common is Hashimoto thyroiditis, or subacute lymphocytic thyroiditis, iodine deficiency. شباب شنو iodine deficiency؟ هسه شنو قلنا ذكرنا which cause which is the most common presentation of hypothyroidism or in areas of iodine deficiency. شنو سمينا؟ goiter. goiter هو قلنا احنا مو it is not a disease entity, it goiter is description of enlargement of thyroid gland, whether for whatever the cause, cyst, neoplasm, thyroiditis, colloid goiter. Iodine deficiency, hypothyroidism due to iodine deficiency. شنو سمينا هسه؟ ليش نقول endemic goiter؟ يا شباب سمينا endemic goiter لأن هو endemic in areas with iodine deficiency اللي هو هسه سمينا كلش common عندنا in the middle of the Iraq, in the north of Iraq. It is related, it is called endemic goiter or colloid non-toxic goiter. So it is started, or it is a case of hypothyroidism. In advanced stage, when there is emergence or when there is emergence of hyperplastic nodule, compensatory nodule, يصير hyperthyroidism. And اللي قلنا عليه هي most common cause of hyperthyroidism in Iraq, nodular hyperplasia and advanced stage of multinodular goiter. So endemic goiter or multinodular goiter is the most common cause of شنو؟ of hypothyroidism in Iraq. Okay? واضحة لو خبطت؟ شباب؟
دكتور ممكن عادة دكتور.
Hypothyroidism, the most common cause of hypothyroidism, let us say in Iraq, it is related to endemic goiter due to endemic iodine deficiency in certain areas in association with certain familial enzymatic defects in adolescent female. And at the start is the female started or there is compensatory hyperplasia ما محسوسة تكون بالبداية with increase in demand during lactation, during pregnancy. The features of hypothyroidism started in semi-endemic goiter or colloid non-toxic goiter. In advancing state, when there is continuous or repeated attacks of TSH stimulation, شباب, there is emergence of hyperplastic nodule due to uneven response of the thyroid follicular epithelium to TSH stimulation. تطلع واحدة من النوديولز هذه هي المالتينودولار نسميها nodular hyperplasia or dominant hyperplastic nodule in colloid goiter اللي هي advanced stage. But the commonest cause of hypothyroidism in our country and in the يعني حتى eastern countries areas with iodine deficiency هو endemic goiter result in hypothyroidism. لازم هذول ينطوهم replacement therapy, ينطوهم thyroxine to overcome the symptoms of hypothyroidism. Okay, there are certain drugs to يعني antagonize the effect of or act against the effect of thyroid hormone and developmental abnormalities like thyroid atrophy or hypoplasia or pituitary disorder, radiation, surgery, any cause that results in atrophy or destruction or surgery or thyroidectomy. It will be associated with hypothyroidism unless it is compensated by thyroid hormone. So the thyroid hormone is under the effect of stimulatory hormone, thyroid stimulating hormone to secrete TSH, T3, T4 for the normal level. Hypothyroidism, eczema in an adult and cretinism in children. Severe hypothyroidism, severe slowness of the all the cell metabolic activities in adults, edema of the hand and face, and the periorbital edema, and the lateral eyebrows and thin and lost, and hair is dry, coarse, and sparse, few. Puffy face and dull face without expression with this dry skin, and this is the myxedema features. And in children there is congenital hypothyroidism, decrease in muscle tone, thick skin, protrusion of the tongue, poor feeding, choking episodes, constipation. So all the features are opposite to hyperthyroidism: short stature, depression, loss of hair, rough voice, and slowness or swollen eyelid, and hearing problem, fatigue and weight gain. Cretinism, comparison of cretinism to myxedema in adult, impaired CNS and bone growth, mental retardation, short stature, coarse facial features, protrusion of the tongue, and umbilical hernia. Myxedema in adult, slowness of physical activities, physical and mental activities, depression, cold intolerance, axial heat intolerance of hyperthyroidism, overweight or weight gaining, opposite to weight loss and hyperthyroidism, low cardiac output or bradycardia, opposite to palpitation and tachycardia, constipation, opposite to high diarrhea and increased bowel motion in hyperthyroidism, and decreased sweating, opposite to excessive sweating in hyperthyroidism, cool, pale, thick skin, opposite to warm, thin skin of hyperthyroidism. Okay, this is the myxedema. Myxedema, excessive accumulation of glycosaminoglycan, called pretibial myxedema, called myxedema in the hand and feet, and hypothyroidism. Again, the opposite. All the features are opposite to hyperthyroidism we mentioned before. Myxedema here showing the bag or accumulation of showing periorbital bag under the eye. It is called Annie's sign. Loss of lateral eyebrow, Annie's sign. This is the Annie's sign. Okay. Thyroid atrophy, congenital atrophy of thyroid gland or developmental atrophy of thyroid gland, apparently associated with features of hypothyroidism, cretinism in children. Thyroiditis, any question till now شباب؟ أكو سؤال لحد الآن؟ أكو شباب سؤال؟ عفو. نعم. نعم. Yes. نعم. Multinodular goiter or endemic goiter. أي من اسمه endemic goiter. أي. Yes. 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 Exactly. احنا قلنا شنو هو it is related, it is أول شيء هو more common and more apparent in female than male. ليش؟ Because it is apparent أول شيء بالبداية before puberty it is not apparent. With increasing physiological demand for thyroid hormone during puberty, during menstruation, during lactation, during pregnancy, there is an increased demand. تعرف الثايرويد hormone is a metabolic hormone, increased cell metabolism. صح لو لا؟ Yes. كل 6 female تقريبا نشوف 1 male. يعني it is more common in female. At the start there is homogeneous enlargement. هاي النورمال thyroid gland. بالبداية the goiter is homogeneous. كأنما شون diffused graves. بالبداية it is not apparent. هذه advanced stage ما عليك بيها. At the start it is homogeneous enlargement or diffused enlargement of thyroid gland. هاي شو نسميها؟ نسميها compensatory hyperplasia. تظل تبقى hyperplastic تشتغل بكل طاقتها حتى to compensate to يعني to go with the or to cover the physiological demand or physiological increase in thyroid hormone requirement during puberty and lactation and pregnancy. Okay? لحد الآن واضح؟ هذه بالadolescent, بالteenager, بالadolescent. تبقى عاد repeated attacks of TSH stimulation كل ما يصير pregnancy أو كل ما يصير lactation أو كل ما أو with increasing body mass أو with increasing bone growth with adolescent. There is repeated attacks of TSH stimulation. هذه at the start قلنا it is homogeneous with repeated attacks during many years. هاي البروسيس تأخذ 15 سنة 20 سنة 25 سنة أكثر. Repeated bouts of TSH stimulation. So the thyroid parenchyma or the thyroid follicular epithelial cells, they are differ in response to TSH. قسم منها they are respond more than other follicles. نسميها uneven hyperplasia or uneven response. يعني part من or nodule of the thyroid parenchyma يستجيب أكثر more than the other فتطلع as a hyperplastic nodule hyperplastic أو نسميها dominant hyperplastic nodule in multinodular goiter. هاي تصير يعني من واحد يوصل 45 كذا حتى تسوي palpitation وتسوي arrhythmias وينطوهم هذا الاندرال. فهو this is the most common cause of hyperthyroidism. فهاي dominant hyperplastic nodule, this is responsible for features of hyperthyroidism in adult female, which is more common in our country and locality. واضح عيني؟ واضح ابني؟ زين. فهسه احنا so the Graves' disease is common in Western countries and nodular hyperplasia or hyperplastic nodule or multinodular يعني or hyperplastic nodule in multinodular goiter is more common in our country. زين. اوكي. سؤال لحد الآن. احنا عندنا محاضرة أخرى وياكم راح نسجل عليها الحضور الساعة 1:00. زين. ساعة 1:00 ناخذكم من 1:00 ل2 ساعة أخرى نكمل هذا الموضوع إن شاء الله، لأن إحنا 18 بالشهر المفروض مخلصين التدريسات كلها إن شاء الله مع الاندوكراين، وأيضا السبت هم ناخذكم بإذن الله. وأي سؤال أنا حاضرة نكمل يوم وقت نكمل 1:00 بإذن الله، بس بعد ما عندنا وقت. يلا you are free now. شكرا جزيلا. نلتقي